Good evening, everybody. My opponent here has argued that he would like to pass a law stating that California would have a similar law to Oregon's program right now, which is a death and dignity law. And his points are that, one, people are suffering from unbearable pain, that two, we're spending too much money on supplies for terminally ill patients, and that it is unnecessary. He goes on to say that California does have a law prohibiting this, and that the only states that are allowing physician-assisted suicide is Oregon and Washington. His plan is to have a law similar to Oregon. So first, I'd like to defend the issue that there are other programs that help in the suffering that terminally ill patients have. There are programs like hospice or VTOS, and the Hospice Patients Alliance affirms that all human life is inherently valuable, and that the role of hospice nurses, physicians, and all other staff is to alleviate suffering and provide comfort for the sick and dying without sanctioning or assisting their suicide. A death with dignity allows for a natural death in its own time while doing everything possible to assure relief from distressing symptoms. So there are programs that are trying to address the issue of unbearable pain without having to just kill somebody. And his second point of spending money on supplies for terminally ill patients is unnecessary. There is a Dr. Merrill Matthews, who is the director of the Center of Health Policy Studies, who argues this question: would physician-assisted suicide save money? The answer to the question seems almost certainly no. The doctor says that primary reason is that the number of people seeking physician-assisted suicide and being granted that assistance is extremely small. Most requests for physician assistance comes in the last month or even the last days of life, which would drastically reduce the amount of the money saved. For example, in a survey of Dutch physicians, 64% said they had shortened a patient's life by less than 24 hours, and in 16% it was shortened by less than a week. So there's not a lot of time that we're dealing with to save billions and billions of dollars. Okay, and to go to the Death with Dignity Act, which they are trying to implement in California, we can't say for certain that a physician-assisted suicide offers a good or peaceful death. And the Physician for Compassionate Care National Director, Bill Toffler, stated the following in June 18, 2006 article, that there's no guarantee that ingestion of a lethal dose would result in a peaceful death. In many cases, the death lingers for hours. It's not a dignified death. It's not pretty to watch somebody struggle for breathing or having irregular, shallow breathing for hours and hours on end. And in addition, my opponent, John, he didn't clarify exactly how we're going to administer this physician-assisted suicide. He didn't say whether we're going to gas them, we're going to give them a lethal dose of morphine, or exactly, are you going to give the patient a gun and let them shoot themselves in the head? We have to be specific on exactly what we can and cannot allow. There are sometimes clinical problems that can arise in a physician-assisted death, and Joanna Groenwood, a medical doctor, found that sometimes clinical problems with the performance of physician-assisted suicide, the problems reported, are frequently concerned with that there are longer than expected intervals between the administration of a lethal drug and the patient's death. So they're suffering a longer time in the dying process, and it's not as dignified as it's made out to be. And in addition to how we should administer this drug, there was some problems. Dr. Felicia Kahn wrote that ultimately arguments for physician-assisted suicide can be effectively countered by data as well as principles. Not only all extant proposals for legalization unworkable or hazardous to vulnerable persons, but the community would be better off keeping physician-assisted suicide illegal while learning how to provide reliable, good care with all serious, eventually fatal illnesses. So it'd be better to enhance systems like hospice than to allow for people to have physician-assisted suicide. And also, lastly, passing this law would burden the elderly. Wesley Smith, a consultant to the International Anti-Euthanasia Task Force, says that bring up the issue of assisted suicide and we are suddenly transported to euthanasia world, an idealized land where euthanasia's dark side is conveniently ignored. In euthanasia world, money is never an issue, doctors make house calls, no one is ever abandoned or coerced, and every death with dignity is freely and carefully chosen just before natural death occurs, and there is no other way to relieve unbearable suffering. He goes on to say, in fact, legalized assisted suicide and euthanasia would take place in the context of a harsher real world of abuse and neglect the elderly, family dysfunction, relatives desiring to inherit property or collect on fat life insurance policies, and subtle pressures on the elderly to cease being a burden. So therefore, I strongly disagree with John in saying you do not need physician-assisted suicide.